What could we do to prevent people having strokes in the first place, rather than waiting for them to get ill and then worrying about the treatment? Copeland, it's a fabulous place to live. It's a beautiful countryside. It's a post-industrial and it's a coastal community. So it's very, very traditional, and lots of people who are born in this area, born in West Cumbria, live and work and stay and have their whole lives in West Cumbria. But one of the issues around population health was heart disease and high risk for strokes. Really felt to me and other members of the community that this was the time and this was the opportunity to look at what we could do as a community on health prevention, because 80% of deaths by stroke are preventable.
So Connecting Health Communities focuses on a specific health and wellbeing area in order to be able to look at how partnership can support more people, the community to be engaged, but also different partners to be engaged in working together to try and tackle a local health problem. The first day was a very stormy day in a social club in the community of Egremont. There was just loads of people in the room. I remember that being really exciting, who wanted to do something about the problem here with the high rate of strokes.
You think about one of those little bags that's got a drawstring at the top. That's what IVAR was, the drawstring at the top that brought us all together and facilitated the conversations that we needed to have and put things into perspective. It's very easy to get lost when you're passionate, when you care, when it's your community, when it's your family, when it's your neighbours. And IVAR gave us that to be able to focus, to drive, and this is what we need to achieve, and this is how we can achieve it. So yeah, it was fabulous.
There was a local traders fair that happened, and a bunch of partners that includes Northwest Ambulance, the local pharmacy, the Rotary and Stroke Association all came together and did a stall basically for people to come and visit, have their blood pressure taken. We were so surprised at the response on that day. Pretty cold, freezing cold day in Whitehaven in December, and we had a queue before long of people just sort of cottoning on that this was quite an easy way to check in on your health and have your blood pressure taken.
Well, today we're in Whitehaven, and this is a social prescribing health and wellbeing festival. You can have a very relaxed conversation, and quite often you might have a husband and a wife or grandparents with their grandchildren, and you can actually get people to, should we do Grandad? So we test Grandad. Has he had it done? Have you been wanting to get it done? It just kind of triggers those conversations. We offer blood pressure testing, which we do in partnership with community pharmacy, atrial fibrillation testing as well, which is testing for heart rhythm. We have conversations with people. That feels in some ways the most important thing.
It's really important to be present at things like this today, because we're getting the chance to see people that might not otherwise go to a GP. We all bring our own strengths to the day. So we've got pharmacy doing the blood pressure checks, we've got myself bringing the knowledge of stroke, we're bringing it into the public eye, helping them be aware of the risk factors, know your numbers and what you can do to bring that down.
With pharmacy, people only come in for a specific reason, where I feel like an event like this, there's a more variety of ages, in like health issues, underlying health issues, so there's more people to come in. Whereas when you're in the pharmacy, they only come in if they've obviously got the issue, and obviously you're not going to know that if you don't get tested.
We're more approachable. We don't offer the white coat syndrome, and it's done quietly. We don't take too much information, so they can't be identified.
It's wonderful to see them still going after these number of years. Even today, they've had a number of people who've registered slightly high on their blood pressure. They can go away and decide whether to go and see their GP or the pharmacist and start to make some differences that will lower that. The group has managed to keep going because it doesn't really cost a lot. It's relatively easy to do, but the benefits and the community involvement is great to see.
I lost my dad to stroke, And when you think that 8 out of 10 strokes can be prevented, sometimes I think maybe if we had the right information and the ability to make better lifestyle choices, things could have been different for us.
Often those that need the most help aren't going to reach out to the council. We support a lot of very vulnerable people, but we can't do that without the help of charities, third sector organisations, voluntary groups, because they are there, they are in the community. We need each other. We can't survive without each other.
When we find a poverty, we've often had people come back to us and say, "Oh, thank you so much. I had possible AF and I went to my doctors and I'm now on medication." And so that makes it,
That must be very rewarding.
it is.
Got skills, we need to use them, don't we?
That's it.
And knowledge.